Hello and welcome to Thriving Students Happy Parents Summit. On this summit, we invite experts to share their knowledge and expertise on how to support children through happy, healthy, and successful academic years. My name is Anna Alba, and today I'm honored and very happy to introduce you my guest. He is one of the most respected specialists in childhood neurological disorders in the world. He has spent his career helping children and adults overcome learning disabilities. And he has taught over 10,000 health and education professionals worldwide. And he has his practice in New York City. I'm very happy to introduce you today, Dr. Robert Melillo. Welcome, Dr. Melillo.
Hi, thank you. Thank you for having me.
Sure. So you created a brain balance program, which is drug-free, right, program and non-medical.
Right.
But first, please tell us how it all started. What got you interested in neurological disorders?
Well, I was always interested from, when I went to graduate school, I was interested in neurology and rehabilitation right from the very beginning. That was something that I gravitated towards. I was always fascinated by the brain. And when I got out, I immediately enrolled in a subspecialty course in neurology, which was an additional 3 or 4 years of school. And then after that, I enrolled in a specialty in rehab. So that was always my interest. But what really got me involved looking at children was when my own son was labeled with ADHD or they couldn't really tell exactly what it was. He was very talented in certain things, but he was very hyper. And so with that, no one could really answer me when I asked questions, because at that point I had been in practice for 10 years. I'd already known a lot about neurology and rehab. I had been teaching, doing some brain research. And so I knew a lot, but I didn't know what ADHD was. I didn't know what autism was. And I went to some colleagues that worked with me in my office. In my office, I had MDs, chiropractors, psychologists, OTs, PTs, Chinese medicine, everything. They all worked in my office for me. So, I knew a lot about a lot of different things. And when I asked people, what was actually happening in the brain of someone with ADHD or autism, nobody can answer me. So at that point, it was pretty frustrating. So I decided to do the research myself, and eventually connected with other researchers around the world, and eventually figured out what the actual problem was. And then from there, it was about what can you do to solve that problem, and then have spent the rest of the time perfecting the solution to that problem, and it continues to grow and it continues to get better. But ultimately, one version of it was the brain balance program and developing brain balance centers. And that, at this point, there's about 130 centers, worked with over 40,000 kids. But I'm doing a lot of other things, and there's also other advanced clinical tools that I'm working with. And so creating other models as well that I think will, where we can use even on more severe cases.
Oh, okay. Could you please explain us what is ADHD, and why do you think we hear more and more about this diagnosis?
Well, all of these things, the research over the past 20 years has really focused on what's called functional connectivity in the brain and network connectivity, and the way that networks in the brain emerge and connect. And what has also been very apparent is that almost everything, and even most adult issues, adult ADHD, but even most adult mental health issues, all start in childhood. So almost everything is developmental, and everything is related to affecting the way the brain and networks connect with one another and communicate. And one of the things that can prevent that, which is what we call a functional disconnection. So functional connectivity is what's supposed to happen. When we have a functional disconnection, that's when things aren't connecting and communicating. And one of the reasons why that can happen is because of a difference in the way that one side of the brain is maturing in relationship to the other. Normally, the right brain develops first in the womb and for the first 2 to 3 years. So both sides of the brain are growing, but the right side is a little bit more active during that phase of growing, maybe 20%, 30% more active. And so what's happening in the world to the child during those first 2 to 3 years, all of the experiences and everything they're going through is having more of an impact on the right brain. So it shapes the right brain. And the right brain is more about forming relationships and more about nonverbal communication, social interaction, being connected to our body and our emotions, our big muscles, getting a big picture of the world around us, coordinating our eye movements and our head movements and our inner ear perception of the world, being spatially aware of what's going on, being able to form more subconscious types of memories, attachment during that period of time. The right brain is more inhibitory in our behavior. It's more cautious. It's more about withdrawal. And the right brain is more about attention. So, out of 5 different types of attention, the right brain has 4 of them. So what we see is that the left brain kicks in after the first 2 to 3 years, and then the left brain forms, and everything that the child is going through between the ages of 3 and 6 then shape their left brain, which is where they get more verbal, they're more doing school, they're more focused on details and more learning linearly and sequentially, and it's more about forming conscious memories, and it's more about fine motor skill, verbal skill, reading, writing, arithmetic, all of those types of things. The left brain is somewhat disconnected socially from other people. It's more goal-directed. It's more self-serving. It's more obsessive and compulsive by nature. The right brain is more connected to people and to the world around us. And so, what we see is, like I said, the right brain is more attentional. The left brain is more motor driven. It's more hyperactive. It's more impulsive. And the right brain is there to calm that all down. If we see a delay in development, where in the womb or for the first 2 to 3 years, there's a slowdown in development, it impacts the right brain more than the left. The left brain may kick in too early. So we get a delay or an underdevelopment, an immaturity of the brain on the right side, and we get this overactivity on the left side. And that is essentially what ADHD is. That's what autism is. That's what OCD is. That's what Tourette's is. That's what tics are. That's what schizophrenia is. The opposite can happen as well, depending on what side of the brain is impacted. But we can get a slowing of the left side where the right side kicks in too much, and this is where we see dyslexia, learning disabilities, bipolar, depression, maybe even things like Parkinson's later on in life, things like that. So these developmental imbalances of growth impact the synchronization of networks. And that ultimately is what almost everything that we see in the neurobehavioral world, in the mental health world, in the education world, and even most of the most common physical health ailments are probably a result of what's happening in the brain.
Oh, okay. Very interesting. So do you think, Dr. Melillo, that people are born with ADHD or some disorders, or it's something that kicks in during first years of kids' development?
I think most of this starts in the womb, or either during the birth process or very early on. Again, most of these imbalances start within the first 6 years, right? When the 2 hemispheres are forming. Because once the right brain is formed, it's always going to have advantages for certain things. And then once the left brain is formed, so once they are doing different things, it only gets more significant as they grow. So most of the foundation is within the first 6 years, but I think most of it starts in the womb.
Okay.
They are not genetic disorders, meaning
Mhm.
they are not genetic mutations. There's no single mutation, certainly. There's what we call epigenetic factors. These are environmental factors that alter the expression of genes, and I think most of those are in place even preconception. But what we also know is that these are not really genetic disorders, but what we have is there are different traits. There's something, for instance, called an autism trait, which, what does that mean? It means that most of family members that are in a family with a child with autism are not autistic, but they look a little autistic, meaning that
Mhm.
they are highly intelligent, they're very detail oriented, they're not very social. They may, have some struggles with, nonverbal communication. We know that as you go up the socioeconomic scale, you literally have more kids with autism and ADHD. And the reason why is I believe that trait is a left brain dominant trait in these families.
Okay. Got it.
So that, one of the things that is, we know that there are genes that are influencing these disorders, right? So like autism, schizophrenia, bipolar disorder. So we know that there are genes related to that. But if the question is, if these genes were, which can have a negative impact and actually don't promote having your own children, usually genes like that go away if they only provide a disadvantage. And if they don't promote having your own kids, then genes go away. And if that's the case, then why do genes for autism and schizophrenia and bipolar persist? And not only persist, but seem to be increasing. The reason why is those same genes that can have a disadvantage must also give us some sort of advantage, at a different level, right? So what we think is that, families that are highly intelligent, which to me is the left brain dominance, these genes, this is a trait. And what do we mean by trait? When someone's smarter or more intelligent or more talented, what does that mean? It means that there are networks in their brain that regulate that skill that are functionally more connected. They're stronger. It's more connected than average. Whereas a person with the average trait of that ability has an average level of connectivity. So what we're seeing is the level of connectivity relates to the level of skill. So if we have people that naturally have more intellect or more better skill in left brain abilities, they have a natural trait that they're born with. Those areas, those networks are a little stronger. And then they can be trained to become even stronger.
Okay.
If you have a really strong version of that trait, what you can get is that these areas can be hyper connected, and then other areas on the other side that balance it out end up being hypo-connected. So what happens is when you have a strong trait, there's also a little bit of a deficit in something else. And that could be, for some people, very high functioning. These are people that might be highly intelligent, really good, but, they're a little nerdy, or they're not so social, but it doesn't impact them so much, that they're still, or you get other people that are so creative, which is the right brain trait, that they're really incredible artists, but they're also a little crazy, or they suffer from, like Bruce Springsteen just wrote a book about how he suffered most of his adult life with severe depression and bipolar disorder. But he's one of the greatest songwriters that's ever lived, which is a right brain creative trait, right? So there's this struggle that goes on. There's this balance of this trait. A stronger trait gives you advanced skills and makes you more successful. Too much of that trait gives you too much of a deficit, and it ends up being a disorder like schizophrenia or bipolar or autism or ADHD. But I believe that we can, drag people back from the extreme version and, make that an advantage again. So again, it's not as simple as saying these are genetic disorders, it's a genetic mutation. There's environmental factors that impact both mother and father. There's environmental factors that impact the individual. There's traits that were superimposed on it. And then there's epigenetic factors. So, there's all these things coming into play.
Very interesting. Thanks for explaining that. And just before, I'm really eager to learn more how the balance between left and right brains could be reinstalled. But before that, just explain us what left brain and what right brain are responsible for. You mentioned it, but just specify.
Yeah, I went through somewhat of an overview, but like I said, the right brain is all about the big picture and looking at the world, looking at everything all at once. It's about controlling the big muscles. It's about coordinating our eyes. The right brain is more visual, spatial. It's about spatially connecting. It's about paying attention. It's more oriented towards the senses and more oriented towards our body and our body feelings. It's the social brain. It's the more, nonverbal brain. So the ability to read other people's emotions and empathize and read situations. The right brain is more connected to our body and connected to our emotions. And we need to do that first before we can read them on other people. The right brain is more, creative per se, or likes newness. The right brain is more cautious. It's more about protecting us. The right brain generates emotions like fear, sadness, disgust, guilt, shame. The left brain is all about details. It's all about, where the right brain sees everything all at once and is intuitive and does things mostly by gut. The left brain is all about the head, right? What's interesting is that in audiences, and your audience can do that, if without thinking about it, if you close your eyes and think, where do you reside? Where does your self reside, right? So just close your eyes for a second and think about where you are, your inner self. Where is that in your body? Point to it with your finger. Point to where you are in your body. Go ahead, point. Right, okay. So what you see is people will do one of two things. They point here or they point here. And I do this in a class, and it's funny, and everybody closes their eyes, and I have them do it without looking, and they go like this or here. And usually left brain people point here, right brain people point here, right? They towards their heart. And it's more, they're guided by their heart or their intuition, where left brain people are guided by their intellect, and they're not really in touch with their intuition. They really are not in touch with other people. The left brain is more goal-directed. It's more self-serving. It's more, seeking something. It's very approach-driven. It's more motor, so it tends to be more hyperactive. It tends to be more impulsive. It's more risk-taking. It's more, the left brain loves to do the same thing over and over. It loves familiarity. So it's naturally obsessive and compulsive. Two emotions really that are unique with the left brain is really kind of happiness and also anger. But the left brain is really the only emotion that is truly just left brain is anger. So what we see is there's a psychiatrist out of the UK named Dr. Ian McGilchrist. He's a well-known psychiatrist, and he just came out with a second edition of his book this year called The Master and His Emissary: The Divided Brain and the Rise of Western Civilization. And it's an 800-page book that is all about brain asymmetry and how it relates to psychiatric issues, but also how it relates to social issues.
Yes.
And one of the things he talks about is that the right brain is really the master, because the right brain can do what the left brain can do, but the left brain can't. And the right brain is connected to other people. The right brain has a conscience. The right brain is moral. The right brain is more, related to feelings, and it's more creative. And the left brain is really just very self-serving. It's very kind of ego-driven. It's very kind of disconnected from other people. Doesn't really have a lot of emotion or empathy, and it is, but very persistent.
Perfect.
anger is part of that. And in his book, he argues how, we've been actually becoming much more left brain as people and as a society. And with that, we see the rise of anger everywhere. Everybody's angry all the time. And a lot of it has to do that. And we're less empathetic. We're less interested in hearing what other people say. We're more we just, are just disconnected from each other.
Makes sense.
Yeah, it's an interesting thing. And he also talks about, right brain deficits as schizophrenia and autism and ADHD, and left brain deficits as bipolar disorder. So,
Dr. Melillo, share with us what can be done to restore that connectivity between the two. So you say that one can be overstimulated, all right, and one part left or right. What your program? What does it offer?
Creating a balance, right? So that's what it's all about. The two hemispheres work in balance. Sometimes they need to work to cooperate. Sometimes they compete with one another. And but they need to always be working together. And if one side gains too much of an advantage, then they can't cooperate, and this side can never, compete or overtake the stronger side. So what we need to do is we need to specifically drive stimulation to the underdeveloped side, targeting on specific networks that are underdeveloped. In my book, Disconnected Kids, which I see right behind you, a good description of all of the different options. And it's different for each person and each child. And there are different ways to do that. But, there's different motor activities. One of the first things that we see is that almost everybody with a developmental issue has the persistence of something called primitive reflexes. These are reflexes that help us to move in the first year of life, but then should go away. And if they don't, they hold us back. I say they're kind of like training wheels for the brain, because our brain isn't really fully formed until really 3 years of age. Even then, it's not fully formed. It won't be fully formed for many, many years. But when we're first born, we don't have hardly much of a brain. So we need these reflexes that come from our brainstem to allow us to move and interact with the world so that we can survive, and also that we can stimulate the brain so it will grow. So these are like training wheels for the brain, right? They allow us to do things when we can't really do it independently. And then they need to go away, just like training wheels need to come off before you can actually, progress to more advanced riding. If these training wheels don't come off, they hold the brain back. And this is one of the first most foundational things that is really key to what I do, is identifying, are there reflexes there? And many times you'll see the asymmetric, where they're present more on one side of the body and the other, and they're not supposed to be. But beyond the age of 1, they should be gone. And when they're there, they block the brain from developing. And that is what I believe slows down the brain, that then allows other areas to become more advanced. And so getting rid of the primitive reflexes and getting rid of what's blocking it, and then allowing the person to also connect more with their body, and then doing specific things to one side of the brain or the other. And those have different layers and different levels depending on age and complexity and skills and all of those different things.
So, Dr. Melillo, this book that I have behind me is pretty resourceful. Parents can grab it, and it guides them by step, right? So there are checklists, there are exercises, and also you mentioned you have over 130, 40 centers in America?
There's 130 centers in America. I have my practice here in New York City, where I do is a different model that I've been working on, because Brain Balance is really more educational centers and academic centers. And so, they're not healthcare, they're not providing healthcare. I also have a model that I've created for healthcare providers, which is, it uses advanced tools like, behind me is a software called NeuroSage, which was built a lot on my work, but we're going to be going through FDA trials on this. So this is using things like video games and virtual reality and specific digital. This is a whole new area of medicine you're going to hear about. It's going to become hugely popular. It's called digital medicine. And digital medicine or digital therapy. The FDA just set up a whole different area of their office for this. And we're going to be probably the second or third company in the world that actually has this approved by the FDA. We're just about to go through FDA trials soon.
Great news.
You know, so these are tools, things like lasers. This is a laser that I use here in my office. So, you know, there are doctors that I've trained around the world.
Yes.
And, you know, we have brain balance centers. Obviously, the book itself, I get letters from people all around the world. It's been translated, I think, into 12 or 13 languages now, just about to come out in Spanish any day now. So there's a lot of different tools for people. You know, what brain balance doesn't work with is really kids that are nonverbal, autistic, or young, and it really doesn't work with adults. So a lot of what I focus on my practice here is adults or kids that are nonverbal, and I get people that travel from all over the world. Like I said, I have family from South Africa, I have a family from Scotland with me this week, family from Austria.
Mm-hmm. Wonderful. Thanks for what you are doing, Dr. Melillo. I would like to ask you, would you like to talk a little bit about the research that you told me about last time, you know, the research by McLean Hospital. And I think it was done together with Harvard Medical School.
Right. Yeah, that study should be out this month, or certainly within the next few weeks. And this is, you know, McLean Hospital is the #1 mental institution in the United States. Harvard Medical School is the #1 medical school. And this is a lab that's been there for almost 30 years, the lab for developmental biopsychiatry. And they've been studying my work, or even just a very small version of my work, but just some home exercises directed towards, you know, directing this towards the hemisphere in kids with ADHD. Similar to what's into the sensory motor component of my book, Disconnected Kids. And the results are really remarkable. I mean, they're showing changes that have never really been documented before, and physical and functional changes in the brain that have never been seen with any other treatment ever before. So, you know, they're very excited about it because they've looked at everything and they've been looking for an answer, and they believe that this is the best answer that's available out there. And it basically, you know, validates everything I've ever said and all the research that I've done. But this is independent verification at the highest level in the world right now. And it's really exciting because it means that we are actually changing the brain, which means that we believe that this will create long-term changes, which is what we see. And that's what every parent wants. And at any age. So this isn't just kids. This is also, you know, adults as well.
Great, great news. I have it actually just in front of me. I looked through your research.
That's the white paper that came out because they were so excited. But the full paper,
yeah, it's just a part of it. Yes,
is going to be coming out probably within the next few weeks.
Got it. And Dr. Melillo, so you one of the chapters in your book is dedicated to nutrition. So do you think that diet impacts behavioral changes? Does it impact learning abilities or disabilities?
It absolutely has an impact. Anybody that thinks that diet doesn't play a role is a fool. But diet is very rarely the actual primary cause. So that's the thing I think that people mistake. A lot of people hear, like, you know, these problems start in the gut. That's not true. They start in the brain, and then they work their way to the gut, and then the gut works its way back up to the brain. So they are important. They definitely play a role. And if they're not dealt with, you will not get as great results. So, you know, looking at elimination diets and vitamins and supplements, I've created my own line of vitamins called Kid Genius vitamins because, you know, I believe that they're so important. And they're the only vitamins that really are right brain or left brain type vitamins. And there's also a gut formula. So I believe that they're very important. And, you know, diet is an important part. And there's a lot of things that are important. And you know, doing advanced blood tests and looking at the immune system. And I'm not a big believer in chelation or the idea of heavy metals. I don't think that is really true. But it definitely makes an impact, but it isn't the cause. And that's the important thing, is to understand that it is. And in some people, it doesn't have any effect. But in many kids, it does have some impact. And in some kids, it can have tremendous impact.
Right.
So, it needs to be looked at and utilized in each child.
Mm.
But just doing that alone is not going to really correct the underlying problem.
Oh, okay, got it. Thanks for explaining that. You've been working with thousands of kids, and I ask this my experts. I ask them this question. So during your all these years of experiences, would you remember a maybe funny or inspirational story that happened to you and maybe with one of your patients, something that stayed with you for years and you would like to share with us?
Geez, there's so many of them. I mean, every one of the families I talk to, their stories are unique and inspirational to me in different ways. I remember one of the first kids I worked with was a child. She was a young girl and she had Asperger's at the time. She was diagnosed with autism and she had no social awareness whatsoever. And I remember we worked with her for a while and she went into middle school. And, she hadn't been there before. So it was new teachers and a new surrounding. And the teacher asked them in their health class one day and said, does anybody ever heard of the term autism? And does anybody know what autism is? And so she raised her hand and she said, yeah, I know what autism is. I used to have it. And the teacher says, I'm sorry, honey, you must be mistaken. Nobody used to have autism. You either have it or you don't. She says, no, I was diagnosed with it officially, and now I am no longer diagnosed with it. And he didn't believe her. So he called up the mother, who was the president of the SEPTA, the Special Ed PTA. And she said, Tara is telling me this, that she used to have autism. I don't think that's possible. So, I just want to check with you and see what you think. And she said, no, she's right. And he said, but that's not possible. And she said, no, it is possible. She was diagnosed officially with autism. She just went back to the same doctors and they just removed her diagnosis. They had never seen it before, but she's absolutely correct. Wow. And the teacher was blown away by that. And that has happened so many times, I can't even tell you. Like I said, we worked with, something like 30, 40,000 kids worldwide. And it's a huge number, as well as 500,000 books I've sold. And so 10,000 professionals. There's so many inspirational stories, and a lot of them are in my book, actually.
Yes. So you have a couple of books, right? So I have just one, Disconnected Kids.
I have 5 best-selling books: Disconnected Kids, Reconnected Kids, Autism: The Scientific Truth, The Disconnected Kids Diet and Nutrition Plan, and the second edition of Disconnected Kids. So, as well as I have a textbook that is called Neurobehavioral Disorders of Childhood and Evolutionary Perspective.
Wonderful. And if we would like to learn more about you or find more about the program that you offer to families out there,
go to my website, drrobertmelillo.com, or get me on Instagram. I do a lot on Instagram and social media, so at Dr. Rob Melillo on Instagram or Facebook, Dr. Robert Melillo. But on any of those things, but just my website has most of the things that people get in touch with me on.
Great.
Okay.
Wonderful. Thank you so much, Dr. Melillo. Very powerful and informative interview. Thanks for sharing your knowledge.
Thank you. Okay. Bye.
Bye-bye.